3, 2, 1.
Hi everyone, my name is Sue Brack. I'm the Alfred Health Graduate Nurse Program Coordinator. Thank you so much for joining us tonight for our webinar. It's a bit different for everybody, so we're going to share some experiences with you. But the first thing that we'll show is a short video.
I have helped a lady delivering in the corridor when there is no other help. So having that newborn in my hand in the dark corridor was one of my most memorable experience.
A family member just randomly pulled me aside and just said, "Thank you." It's something small, but that really made my day.
Providing care for patients with stem cell transplants, it's really rewarding to see them once they're well again.
COVID's had a big impact on all emergency services. Just to be cautious about preventing the cross-contamination.
It makes me really compassionate towards my patients and how scared they are with everything that's going on. It also makes me really value the work that we do here.
I believe nursing is the only profession which allows you to care for others, give a helping hand to others when they are in need of it.
It allows me to be able to care for people on an individual level, spending time with my patients, getting to understand what really drives them and what they really want to get out of getting better.
It's not only just a noble job, but it's also a very rewarding profession. And I'm really proud when I can help restore patients' confidence and their feelings of self-worth.
This International Nurses Day marks a point in our history that really demonstrates the contribution of nursing in healthcare. And I want to say thank you for your contribution in making a difference and making the patient experience at Alfred Health one that is really exemplary.
Hi everyone, bear with me. This is the first time I've done this, so I really appreciate your patience. So as I said, my name is Sue Brack. I'm the grade coordinator here at Alfred Health. To start with, I'd really like to acknowledge the Boon Wurrung, people of the Kulin Nations, the traditional owners of the land in which we are gathered today. So tonight's webinar, basically we'll have varied speakers to share their role and their experience within our grad program. So you can see the different positions up there and we'll introduce them as each person comes up. Whilst the webinar's on, some of you have already started posting some questions on our Q&A platform, and I've got a team behind the scenes that are actually answering some of your questions. And then at the end of all of the presentations, my colleague and I will actually share some of the answers to the most common questions that you're posing on this forum. So the Alfred Health Graduate Nurse Program, we basically have two programs. We've got the General and Mental Health Program, and both focus on clinical support and your development as a professional nurse. So basically at the moment we've got 3 campuses at the Alfred Health, so you can actually see up there that there are general positions. So we have roughly about 2/3 or 3/4 are at the Alfred campus. There's 22 positions at Caulfield and 9 positions at Alfred. That's something that we will be confirming as time progresses, because obviously this year's been a little bit different with all the COVID measures that have been in place. So my colleague Shana McCormick is also available online in the background, and basically they have 10 positions for mental health each year. So the Alfred Health, I'm sure most of you know, but if you don't, it's actually one of Melbourne's largest teaching hospitals. It supports undergraduates, postgraduate training for medical, nursing and allied health. It is a 400-bed hospital and provides a comprehensive range of specialist medical and surgical services. Some of you may be aware that we have a lot of burn statewide services, such as burns, transplant for both respiratory and cardiac patients. We obviously have a very large emergency department with the helipad. So there's quite a lot of different specialist services both across all 3 campuses. For the graduates that are actually allocated to the main campus, they may actually undertake a 12-month placement rather than 2 6-month clinical placements. So I guess one of the things that's a little bit different for Alfred Health and graduates that come there is that majority of our grads spend 12 months in one area. And the reason for that is that a lot of our specialty services both have medical and surgical patients in the one ward. And so we actually find that you're still getting surgical and medical experience caring for that patient population from the time that they're actually admitted to hospital until the time that they're discharged home. Some of the others will actually get 6-month placements, but it is majority will have 12 months at the main campus. At Caulfield, so again, we have most of the graduates there will all undertake 2 placements, and these are 6 months each. So they may start at Caulfield and go over to Sandringham, or some actually come up to the main campus as well. But the areas at Caulfield actually are subacute medical, because a lot of the patients will be transferred over from the main campus at Alfred Health. And they also have a lot of specialist rehabilitation areas. At the moment, that's been done a little bit differently with COVID, but those patients have now been placed in the aged care facilities that are there. There's also the state-of-the-art acquired brain injury unit, or ABI unit, and that's where a lot of the trauma patients who have suffered neurological deficits will actually go over there after their time in at the main campus. Our third campus is Sandringham Hospital. Again, that's where graduates will undertake 2 placements. So they may have 6 months at Sandringham, 6 months at Caulfield, or actually come up to the main campus for 6 months as well. So down at Sandringham, we have both surgical and medical areas where the grads are actually allocated to. The other areas that we've got where we have graduates is the emergency department there, which is a 6-month rotation, and the operating suite placement there is actually for 12 months, and they usually align up with the graduates that are in operating suite up at the main campus as well. As you can see, I was mentioning just before that there's a lot of state services and specialty services at Alfred. So up on the screen, you can see quite a range of different wards that we have, and just reinforcing again that we have graduates in all of the areas that are listed up here. And basically it may be, as I said, 12 months or 2 6-month placements. Clinical support is a key thing for graduates at Alfred Health, and it's one of the things that we really pride ourselves on. So it's essential to the success of the program. And so through that, we have a lot of support staff, which I've listed on the bottom of the slide. So preceptors play a pivotal role supporting our graduates. Our clinical support nurses, and I have 2 here tonight that will actually share their experience with you. We have nurse educators, clinical support and development nurses, and obviously the clinical experts. The pivotal thing is that the graduates are part of the team on the ward that they're working on, and they, in conjunction with that, are undertaking the graduate program. So all graduates receive a comprehensive orientation program, and we have a 3-week supernumerary period, which I'll go into more depth on the next slide, with graduate and preceptor, and as it states there that there's individualised ward preceptorship. So the induction model for the Alfred Health graduate program, week 1 basically is where the graduate is actually supernumerary. So the first day is where everyone will receive orientation or induction to the organisation. So in recent times, because of COVID, we've done all of that online, but normally it would have been in the past face-to-face. Day 2 is divided up into 2 half-day sections. So obviously the graduates would receive ward orientation in the morning, and they meet their preceptors where they can. And in the afternoon, they'll actually come over to a different room where there's myself and the team that are supporting them in the clinical areas, our clinical support nurses, where we actually give them an overview of the graduate nurse program. So the days 3 and 4, so it depends on the roster for that week, then they'll be working with their preceptor. And the model we have here is a 2-to-1 model. So there's 2 graduates to 1 preceptor. And so as I was saying before, week 1, the graduate is supernumerary. Weeks 2 and 3, it's a role reversal. So because the preceptor is looking after 2 graduates, then the preceptor is supernumerary at that time. So the goal is that we have the graduates and preceptors working similar rosters even beyond that 3-week period has concluded, but there's also all the other supports that I listed on the previous slide as well. So the key thing is that the grad program is a 12-month structured program. From the beginning, very much the graduates are dependent on all of the staff. You're all coming from different universities, different experiences, and we're helping you during this 12-month transition program to pull everything together. The key thing, because we commonly have previously up to 170 grads in the program, is that there's staggered starts, so that then through that the numbers that are coming in each time, which is January, February, April and July, that we're actually matching you up with the wards, but it's so that we can give support. It also means that if people are finishing their undergraduate studies, that they've actually started later than the beginning of the year, that they may come into the April or July intake. So that's one of the pivotal questions that we ask on the application form. So I guess the key thing is that from the time that you start all through the 365 days, you've got ongoing support from all of our ward staff. Our clinical nurses are there from the time you start all the way through to the end. And as we said at the outset, then you've got supernumerary time with your preceptors. And what you actually find is that you build really strong relationships with those preceptors, and often they'll be your friends ongoing as part of the ward unit. Within the graduate program as well, we do have 3 study days throughout the year, but as an ongoing thing, we have weekly tutorials, which our clinical support nurses actually facilitate every Friday afternoon. And then that way we're getting all of you together who can actually attend on that. We've been doing teams this year to do that so that we can keep them going, but it's normally a face-to-face where you can actually share experiences. Some of them are tutorials where it's talk and you're all sharing. It might be a debrief session, or we actually get some of our experts and specialists to come around and share some information with you to improve both your knowledge and skills. So, as I said, it's a structured program. We've also got hurdles that are set up over the 3 months, and the hurdles are there. They're all clinical, just so you're aware, apart from one, and it's so that then we can make sure that you're moving through the year, you're getting the assistance and support that you need, and as you're moving through that, you're also getting the challenges. So obviously from the first time when you're starting to the end of the 365 days, we're trying to then make sure that what we've covered is preparing you for your career beyond the graduate program, and that you feel comfortable to actually then go to stay on your ward if you like, by reapplying to stay there, or go to another area. But we're making sure that we're giving you a very solid foundation so that you're comfortable to actually move anywhere in the future within the organisation. All graduates are employed on a 12-month contract, and you're actually working 0.8, which is 4 days a week. We've actually had that in for quite a few years now, and we find that that actually helps with work-life balance, and it's working very well. As I said, only a portion of our graduates rotate, but what I actually find is commonly is when people are coming up to rotate, they'll actually say to me, "So I actually want to stay where I am." So it's a mixed bag, and I've got 2 graduates that will share their experiences with you shortly. One who had 12 months in one area, and one who's actually undertaken 2 6-month rotations. In terms of retention for our graduates, you're investing in us, we're investing in you. And so the key thing is that we do want to retain our graduates. We have about a 95% retention rate, and ongoing employment opportunities we have, which I'll talk about shortly, is a CAP program, or there may be postgraduate studies in the future. But the key thing is just get your feet on the ground through your graduate program, and then explore a few things later, because what you think you've got an interest in and what your specialty might be later actually changes over that first 12 months and even a few years later. just put up 2 pictures of a couple of our grads that have been in. So Tash is on the left-hand side. One of the other projects or hurdles that we have is our graduate quality project, and Tash actually undertook one last year, and so we've actually introduced our electronic medical record, and one of the things that we have is what's called the BMR, which is the machine that everyone's using, and she did a fantastic job looking at the cleaning and all of that to make sure that no patients, that there was no cross-infection, and that's certainly something that has been obviously for all of us through this COVID time. It's essential at any time, but there's additional measures at the moment. Ronnie's, who's on the other side of the screen, she was a graduate year a few years ago. Then the following year went on to win the Outstanding Graduate within the HESTA program, and then she's still here, which is fantastic, and currently completing her Masters of Nursing. So the application process at Alfred Health, the key thing that you have to undertake is that you are registering with Computer Match, and then you are applying directly online to Alfred Health. So all of you know the website already because you're actually here tonight, and the position description is up there. The one thing that's a little bit different this year is that it opens on July 13th and closes August 3rd, and that's because of the COVID measures that have actually delayed everything for all applications across the state. So you will be able to hit how to apply. The key thing that's up there, and then quite a few of you have been interacting and talking to me, is so that you know, we need a cover letter and your CV, and then obviously getting you to upload some of your recent appraisals, and the dates are there. We don't want the whole tool because some of them in different universities can be up to 50 pages. So we'd actually just like 3 to 5 pages. We also need a copy of your most recent academic transcript and details of 2 referees. So that's something, again, that's different this year. You will actually be sending your referees to Computer Match, and this is being sorted out in the background. So I will answer questions later, but I am aware that some of you have had your placements cancelled because I've had a few things. So what I've been saying to people is that just put that in your CV and cover letter, because by the time you may need to start, then hopefully you've undertaken that clinical placement. So the other thing that's a little bit different this year, and we're waiting for the recruitment process to be confirmed, is that the Department of Human Services and Computer Match is looking to have it standardised across the state, where all applicants actually undertake a video. So watch this space, and as soon as we get more information, all the universities will know, and it will also be up on our website. The other thing I've put here is that we've got tips on our website for how to do your CV and cover letter. I know all of the universities support you guys and help you, but I've actually just put this link up now as well, because the Department of Human Services provides this excellent link and actually goes through everything for you from where to go on making sure that your application is successful. What happens afterwards, after you successfully completed your program, we have what's called a consolidation and transition program, and that's to support people in their second year. It can be after that. It doesn't necessarily have to be straight after your graduate program. People are doing it 1 year out, 2 years out, 3 years out, whatever, or you don't have to do it, but there's options. There's obviously a huge continuing professional development program because we're in a teaching hospital. There's postgraduate studies which are affiliated with La Trobe, Monash and Deakin universities, and there's diverse nursing specialties here and a lot of career opportunities. So the details here, you would have already seen them on the website, but I'm just letting you know that. So my details are there, and my colleague Shana McCormick, you've already been emailing and calling us, but if you need any assistance after tonight, then please make sure that you can call us on those numbers. So what I'm going to do now is just introduce my colleague, Kathleen Fallon. So I just have to, that will come up. And so Kathleen is the Chief Nursing Officer, the Deputy Chief Nursing Officer. So I'm just going to step behind Kathleen and go to the side so you can see we're doing a good tag team here, and then Kathleen will come up on the screen for you.
Thanks, Sue, and welcome everybody. Thank you for taking the time this evening to join us. on this information session. And as Sue said, my name's Kathleen Fallon. I'm also the Director of Corporate Social Responsibility here at the Alfred, which takes in a number of areas that often nursing don't get involved in, but really influence greatly. So I've got a bit of a dual role here at the Alfred. And I guess the first thing I'd like to say is just congratulations that you've all made it to a point in your careers that you're making some decisions about the next steps and what's the best thing for you all in terms of the really what is an exciting part of your career. So congratulations on getting to where you are. And I'm about to do a very short presentation just about nursing services at Alfred Health. I guess Sue touched on this a little, that Alfred provides such an extraordinary environment. We are one of Australia's leading health services, and that goes across the board, whether you're a new grad, an experienced nurse, somebody who's looking for a change in their career. The opportunities that are provided here at Alfred are amazing. I've been here for the last 10 years. I actually started as a nurse at the Alfred, started my training here many years ago. I won't declare how long ago. And when I came back to the Alfred, I was just so pleased that the nursing culture is as strong as it always has been at Alfred Health. I'm a member of the nursing executive, but first and foremost, I'm a really proud nurse and proud to say that I'm a nurse at Alfred Health. And I think part of that pride is what nurses can achieve. And I guess the recent environment of COVID has just shown me once again how flexible, adaptable and amazing our nurses are. So as I said, Alfred is an extraordinary environment. Sue touched on the statewide services that we provide. And Alfred is a health service that we are often called upon to do unusual and often interesting things because we are a trusted health service. So some of the examples just recently, we're being part of temperature checking and screening all the people who are coming back from overseas and shored up in hotels all over Victoria. So we've been asked to provide oversight, governance and leadership in making sure that those people are safe and that the community is safe. So something as random and diverse as that to obviously making sure we're ready if we had a surge in activity for COVID-related patients. So the breadth of experience and opportunity that's available to you at Alfred Health is amazing. And I guess just reiterating the amazing nursing team that I think we have here. The way we sort of structure the way we provide care at Alfred is we talk about patients come first. And the patients come first strategy is an interdisciplinary strategy that is designed with and for patients. So our Consumer Advisory Committee owns the patients come first strategy and really influence what are the priority steps that we need to take to ensure that we are facilitating the best patient care that we can. And it provides a framework that underpins the essential nursing practice. Not only that patients receive safe and quality care, but that we do it in partnership. It's a plan really, and I guess everything that we do is focused back to patient-centred care and the patients come first strategy. It is all about working together and engaging with patients as equal members of the healthcare team. Nobody looks after themselves better than the individual. So I guess what we are striving to do at Alfred is to really engage with patients in what matters to them, what's important, and what are they striving to achieve as part of their hospital stay. Often very unplanned and in traumatic situations, people come to us and the outcomes that they want to achieve may not be the same as what we think. So it's always important that we engage and work together. And that's really what our Patients Come First strategy is all about. Key element of all of that is the influence that nursing has on providing that care. We're the only profession that is here 24/7, 7 days a week at the bedside. And the influence that we have on patient outcomes is paramount in the feedback that we get from our consumers. People often say it is the small thing that matters. It's taking the time to say thank you. It's taking the time to find out how somebody is, what's important to them. And I guess it's the challenge to say seeing the person in the patient. I can't emphasise enough how important that is to us at Alfred Health. And it's always easy to say, I'm a patient-centred person, I look after patients, I care for patients. But I guess it's taking it back to what are the expectations that you have about how you might be treated, and what care would you want for your family, a member of your close network, a little small bubble now that we're in COVID, or a friend of yours. And I guess putting it in perspective and really taking that approach of what if that was me? How would I like to be treated, and what expectations would I have? And sometimes it is just as simple as taking that little bit of extra time to say, what's going on for you today? What's important for you today? And it may not be what we think. So really that's how we're focusing what we want our nurses to really be thinking about and concerned about in everything they do, from the way you walk down the corridor to the people who are lost and can't find their way, and taking the time to stop and find out and see the person there that is often very stressed when they're in a health service. I guess we aspire to be the safest hospital in Australia. No small ask, but we think we're got very good systems in place that not only keep our patients safe, but actually look after our staff as well. Safety is about everyone, and I guess we aim to be safe so that our patients' experience is exemplary, and that they're well cared for and can continue and forget about us once they've left the hospital setting.
Thanks, Kathleen, for your presentation. We're now crossing to Gemma Davidson, who will share her experience as a graduate nurse in our program. Thanks, Gemma.
Hi everyone, my name is Gemma. I just recently finished my graduate year on Ward 7 East at the Alfred, which specialises in haematology, oncology and bone marrow transplant patients. So I'm just going to be answering a few questions. The first one is, what has it been like transitioning from a student nurse to a registered nurse? I think the initial jump from student to RN, in those initial few days, I found it quite a big leap actually, but more for those, just the little things like you don't need to get a Panadol double checked, which I found quite terrifying. But after that initial shock of having so much independence, I found that the learning curve became actually quite gradual, that every day you're learning something new and you slowly become your own person and you find the way that you really want to do things. I found that that was a really gradual process as well, that you get 6 or 9 months down the track and you don't even realise how much you've changed until you look back at really how far you've come. The second question, what support has been available to you as a graduate nurse and how have they supported you? So as a grad, the support that you have is honestly really endless. So you've got your preceptor that you work really, really close with during those initial few months at the Alfred. To this day, I still go to my preceptor with all of my questions. And then on top of that, you've also got your clinical support nurses. So they work just during the week, but they were probably the support that I found really most beneficial during my grad year. The wards can be a really tough place sometimes. And I found that my clinical support nurses had this probably insane psychic ability, and they would just pop up and appear on the ward whenever you needed them, even if you didn't realise that you needed them at the time. And they were the best people to just talk to and debrief or have a good cry, and that emotional support that they really provided you with alongside with the educational support I found really vital to really just surviving my grad year. But then on top of those grad specific supports, you've also got your ward supports, I guess. So you've got, your ward specific educators, your unit manager, your ANUMs, your clinical nurse specialists, your senior staff. All of them are so knowledgeable and so happy to help that, even if it's 2 o'clock in the morning on a night shift, there's still support if you really need it. And I don't think there's been a single day that's gone by since I started working here that there hasn't been support available when I've needed it. How often do you have study days? So at the Alfred, everyone is allotted 3 study days per year. They are already pre-allocated as grad-specific study days during your grad year with your intake. But then on top of those study days, you also have the opportunity to go to Friday tutorials, which I would highly recommend. So each Friday is an hour-long session and they focus on something different each week. I found this really beneficial because the ward that I work on is such a highly specialised area that it gave me a good opportunity to learn about things that I wouldn't have otherwise had a chance to learn about. What is your most memorable moment that has made an impact on you as a registered nurse? This is a really hard question for me to answer. I don't think there's any particular one moment that's made more of an impact than any other. I think honestly, every day has its little victories and there's positives to take from even the worst shifts that you could, like, something as simple as you realise how much you've grown when the next intake of grads start, or you're thrown into a MET call and you realise that you can look after such an unwell patient when previously in the past that's not something you've been able to do without support. Some of the best victories are just little things like liaising with the medical teams or the multidisciplinary teams and just advocating for something that your patient really wants or needs. I think that there's honestly something memorable to take out of every single day. And then the last question, why should you apply for a graduate year at Alfred Health? I'm a huge advocate for Alfred Health. I think Alfred is the home to so many different statewide services that it really allows you an opportunity to learn about and work with patients that are so acutely unwell in such highly specialised fields, such as your burns, your traumas, your transplants. But then even if that's not something that you're particularly interested in, the Alfred has so many different career opportunities and pathways that there really is a home for everyone at Alfred Health. When I was in your situations and having to decide about which 4 hospitals to apply to and then which orders to rank them in, I was very stressed. But I do not regret anything about preferencing Alfred Health. My team and my ward have really turned into my family, and all the experiences that I've gone through have really shaped me into the person and the nurse that I am today, and I wouldn't change any of it. I really hope this has answered some of your questions, and I wish you all the very best with all your applications. Thank you.
Great, thank you so much, Gemma. So now we're going to cross to Paul Attard, and Paul is another one of our graduate nurses doing the program this year. Over to you, Paul.
Thanks for that, Caroline. Hi, my name's Paul and I commenced my grad year in July of last year at Caulfield on AC2. I'm nearing the end of my second rotation on 7 West at the Alfred. This ward has a number of specialties including gastroenterology, stroke, neurology and infectious disease. During the COVID pandemic, it has become a dedicated COVID ward owing to our infectious disease expertise and our neg vent facilities. This has made for a very interesting rotation and one where all staff have been challenged to use and contribute to approaches that minimise infection risk while providing a high standard of care. The transition from student nurse to registered nurse has been definitely challenging, but extremely rewarding and satisfying. From commencing my grad year, I still had that nagging worry I carried throughout my nursing degree. Although I'd enjoyed my studies, I didn't really know if this was going to be the career for me or if indeed I was up to it. No small concerns, especially for an oldie like me. Hence, when I started, although I was surrounded by understanding and supportive staff, I was extremely keen to measure up. Working alongside people with highly developed capabilities added to this feeling, making me impatient for my own development. Regular discussions with my colleagues, as well as regular reflection. Right, Caroline, sorry.
Thanks, Paul. Thank you very much. So what we're going to do now is cross to Kat, who's one of our clinical support nurses. And Kat's also going to share her experience as a support nurse for the graduates. Over to you, Kat.
Hi, my name is Kat Christook. I am one of the clinical support nurses at the Alfred here in surgical services. So my role is pretty varied as a clinical support nurse, and it looks completely different to all the different grads, and we're utilised completely differently as well. So it might be that you have a new procedure that you've never done before, like a PIC dressing or something, and you need someone to come and show you how to do it, or you just want someone there to educate you and talk you and coach you through that. So we can definitely be there for you. Like Gemma was saying earlier, a huge part is about debriefing. So it might be that you've had a Met call for the first time and you have no idea what's going on and you just want someone to talk you through that, or you just need to have a good cry after that, and that's absolutely fine. So we do a lot of debriefing on the ward as well, and particularly because we're not actually part of the ward, so we're an outside sort of source that can give you that extra aspect. We play a large part in your graduate hurdles and your assessments. So we do a lot of bedside education, and it might be that you've just got a really complex patient that you don't understand, and we can help you understand that patient so you can care for them more appropriately throughout the shift. And look, at the end of the day, it may just be that you're having the worst shift. It's busy, your buddy's in a Met call, and you have 1,000 checks and, you know, lots of things to do, and we can just come and help dig you out of that and just be that second pair of hands to get you back on track. So I find my job really rewarding, and the best thing I think is watching that transition of having a student turn into a graduate nurse, and then all of a sudden they're a confident registered nurse, and out of nowhere they're an expert in their field. And there'll be a day that I turn around and I have absolutely no idea about what's going on with a patient, and I'll come to this graduate nurse and you can see that confidence grow and go, oh yeah, no, I know what's going on. I can tell you, I can educate you. So yeah, it's a little bit about my role. Thanks for listening.
Great, thanks, Kat. We're going to cross back to Paul Ashard, our graduate nurse, to finish off just some more comments about his program. Over to you, Paul, again.
Thanks again, Caroline. So I was talking about just being integrated into the workforce over Caulfield on my first rotation, and I was a bit impatient with myself because I'm seeing all these highly talented people around me really cruising through their work. But regular discussions with those colleagues, as well as regular reflection, helped me to navigate those tricky first few months. The most important realisation I came to during this period was to be kind to myself, to enjoy the small successes and landmarks as they came along. This helped build my confidence and develop a positive outlook towards any challenges that came along, helping me to see them as opportunities rather than obstacles. Patience is also vital. As a grad nurse, you have a host of immediate challenges, such as trying to navigate a complex computer system, finding the locations of diverse items, operating temperamental equipment, while simultaneously trying to improve understandings of medications and pathologies. This won't happen overnight and just takes time. So in short, no killer tips from me, just be kind to yourself and be patient and you'll get there. All the way along my journey, I've had access to ample support. Initially, I worked very closely with my very understanding preceptor Errol, who seemed to have infinite patience for the unending stream of questions I had about every imaginable aspect of ward life. Your preceptor will be a crucial point of reference in your first rotation while you find your feet. The clinical support nurses are ever present and are always ready to lend a hand. They've been able to help me with anything, whether it be providing a check, assisting during Met calls, or just being an extra set of hands when busy. The most invaluable service they provide is their expertise, helping you to put into context the very situation you may have just emerged from and giving you ideas for how you may tackle that situation in the future. Nurses are also easily accessible and always asking if you need help. Like CSNs, they have often been that extra set of hands just when I've needed them. They're also a great sounding board for clarifying your understanding of technical matters or explaining the nuances of a technical procedure. They'll often organise education sessions for grads or the whole ward on a range of important topics. In common with all other nursing staff, they're also great for debriefing with and putting things into perspective, as they have a wealth of experience to draw upon. The grad program at the Alfred ensures that learning continues throughout our grad year. At the scheduled study days, there have been expert presenters across topics such as diabetes, self-care, and CVAD maintenance, to name just a few. Playing with some of the equipment was a great way to supplement the learning. Outside of COVID times, tutorials run once a week are an excellent opportunity to catch up and swap stories with fellow grads, as well as receive further education. There have been many memorable moments for me during my grad year, and I'll carry them with me forever. In particular, I've enjoyed the teamwork aspect of both my rotations, and for me, that's a big attraction working as a nurse. The most memorable moment was caring for a non-English speaking man suffering with COVID for several weeks. Although he was often tired and very unwell, we developed a strong rapport, and even when he was finding it hard to persevere and I had to be persuasive, I realised he appreciated my persistence. It was very hard after nursing him through some long met calls late at night in full PPE to see him eventually transferred to ICU. But I've treasured memories of the little bond we formed and his appreciation of my care despite the barriers. So to sum up, I've had a wonderful grad year and would unreservedly recommend the Alfred to anyone. There's been no shortage of support. The staff are skilled, dedicated and caring, and you'll be embraced as an equal in the team. The COVID pandemic and the Alfred's key role in treating some of the most unwell people in the country underscore its importance to Victoria's healthcare system. Thanks for your time. I hope it's been useful, and best wishes with the computer match process. Over to you, Caroline.
Thanks, Paul. So we're just going to swap positions, and now we're going to hear from Dylan. Dylan's one of our clinical support nurses who support the graduates. Over to you, Dylan.
Hi guys, my name is Dylan. I'm one of the clinical support nurses for Alfred Brain. So I cover the neurosurgery, neurology, neurotrauma sort of areas. My role, as similar to Kat's, is supporting the grads through the early stages of the grad year. So especially during the transition, as Jim said, from an undergrad to a graduate nurse, which can be one of the most challenging things for our graduates, and they're helping them finding their nursing style. So every single nurse, as you also work out, has their own style of taking care of their patients. And as time goes on, you'll learn the best ways for you. So one of my roles is supporting that and helping you find the best way to remain safe, but also to get the greatest enjoyment out of your grad year. I also work really hard with building relationships and trust with the grads, so being there in supportive situations. It might be as simple as doing checks and watches to, as Kat would say, debriefing from met calls and such like that. So it's a really important role that we build strong relationships with all our grads. So I also enjoy working with the grads to identify their learning needs, but also the ways that they learn, because every single graduate is different in the way that they actually go about things and the best ways that they learn. So identifying that is a really important part of our role. We understand that everybody's different and nobody learns in the exact same way as the next person. So I find that a really important part of our role. The other important parts is actually learning how to work on each ward. And every ward has a different ways of managing things and different routines. And so we really work hard at putting you into the team and focusing on how you can actually work well with everybody else, as well as remaining as an independent nurse. It's a very important part of developing skills is remaining as a team member amongst plenty of other nurses, senior and junior alike. We also work really hard on assessing your skills and guiding your patient care and working on your prioritisation skills, and working with you to learn these things in the most organic way that we can without force-feeding you any sort of information. That is basically a bigger part of our role. One of the more rewarding parts that I see in my job regularly is seeing how proud my graduates are when they've learned something new, when they can actually impress themselves with their own knowledge. Regularly, grads will actually teach me things and will surprise themselves that, one, I know everything as much as I'd like to think I do, but two, how much knowledge they have to give other people. And it's so important in empowering everybody to know that their knowledge is just as important as my knowledge. So I love seeing those little light bulb moment where they actually realise they know a lot more than they give themselves credit for. And seeing that confidence and that excitement grow. I worked with Paul for the last 6 months and seeing his confidence grow and his assessment skills His skills in met calls grow exponentially to the point where I know exactly what he's going to do and I trust his nursing skills exponentially. That has been one of the most rewarding parts of my job, seeing how everybody develops in their own way and becomes better and better with each day and each shift, seeing their confidence grow. So thank you very much for listening to me, and good luck with your applications and good luck with your graduate year next year.
Thanks, Dylan. We're now going to cross to David Wright. David Wright is one of our nurse managers to share his experience working with graduates as well. Over to you, David.
Hello, as I said, my name is David. I'm currently the nurse manager of the renal and dialysis ward here at the Alfred. I've spent most of my time within surgical services. That's where I started off here as a graduate as well. I guess how I support graduates as a nurse manager really is about working with the wider team, like you've heard from some of the clinical support nurses and Sue and Kath, how the team will come together. But really what the managers are here to do is really support you on an individual level. So we meet with you regularly, we make sure we're available for you. We, first and foremost, we always try to be approachable. It's just basic things like we try to work with you on your rosters, to give you that work-life balance. I think it's really important in your first year of work that you do kind of figure out how shift work works for you and what that looks like. And it's definitely not the same for each of you. What I find, I guess, rewarding about being a nurse manager with the graduate program is often when you think back about your time on the ward, you often think about a particular patient or a particular staff member, but what I find great is when they go together. So recently I had a patient on my surgical ward that was there for about 12 months and they were actually admitted in January. And I remember they were there the first week my January grad started, and I just remember seeing how scared both of them were. So it was really interesting to see patients, are the most vulnerable, and we've got brand new staff and really the support with the graduates and seeing how they work, effortlessly to improve patient care and just watching the trajectory of, this patient going through quite a lot and then seeing their graduates kind of, just continuing with them and really improving. And by the end of the year, we obviously had a positive patient outcome because they were discharged, but by the end of that 12 months, we had an excellent group of graduates who really grew throughout the year. And I think that was really rewarding to see a positive patient experience along with the graduate experience. I guess the tough question is I get asked a little bit is, what are you looking for in a graduate? How do I stand out? Or, what are the qualities that you want to see on the ward? And I think what we're after, well, what I'm personally always after is someone who has a really positive attitude. You're eager, you're proactive, you don't wait for everything to be kind of presented to you. You seek learning opportunities, you really work within the team, and ultimately you have that patient focus, and everything we do is for the patient. But I think what you'll see here if you are successful in the Alfred is the teamwork that goes behind patient care is outstanding. And I think don't ever underestimate your role as a graduate within that team of providing that care. So that's all for me. I wish you all the best for your applications and good luck.
Thanks, Dave. So now we're going to cross back to Sue Brack, and we'll just try and answer some of the questions that you've posted online. So Sue, I've just got a few questions for you. What's the interview process considering the COVID situation?
So as I briefly mentioned just before, we're actually working very closely with the Department of Human Services and Computer Match. And they're looking to set up a process where graduates undertake, or applicants actually undertake interviews, because we have all the COVID measures in place with social distancing. You obviously can't come in and do a face-to-face interview or group activities depending on what different organisations will want. So certainly it's been something that's already been utilised for medical staff this year, so it looks like we'll be potentially following the same process, but I still have to have that confirmed. So it's basically that it's an online video which then will be I guess loaded up onto the site that's there, and then that goes through to Computer Match with, or we get the ones where you've selected the 4 hospitals, and all of you that have selected Alfred Health, then obviously it's standard questions that are going to be on there, and we're currently reviewing those so that then they can be placed on there, and it's a process that should make it little bit less stressful, and that's the goal of this because of what's happened with COVID, that we try to keep it simple and as streamlined as possible for all applicants. That's the goal. In terms of mental health, that's a slightly different process. So my colleague Shana has advised me that you'll be invited to an online session with the mental health people, probably via Teams, and that they'll actually send you an invitation with a date 10 days prior to your actual interview.
Thanks, Sue. Another question, can international students apply for the graduate program at Alfred Health?
So for the mental health program, then yes, you can apply, international students can apply. For the general program, it's always been in place that basically it's those who are working within the state. That's who will be applying for first round offers. And certainly for second round offers, it's those who are interstate or New Zealand. And then international students would be third round offers. But as I mentioned earlier, to be for all public hospitals, you need a computer match number. So that's why for the general program, you would need that. And it would only be if we didn't match that we would go to second and third round. So certainly since I've been in this role for the last 9 years, we actually haven't gone to second round offers. So generally international students don't get an opportunity to apply for the general, but they definitely can for the mental health program.
Okay, thanks, Sue. Can students choose a campus, or can they choose their campus across the 3 campuses?
Okay, again, I'm just going to answer for mental health first. They all go to the main campus. So for the general program, because we have 3 campuses, the key thing that I'll reinforce to all of you is that you're applying to Alfred Health that has 3 campuses. And you will certainly get an opportunity to put your preference, but I can't guarantee all of that because it's common that probably a majority of the applicants will want to come to the main campus. But as I showed you before during my presentation, we actually have services at all 3 campuses. So you're applying for Alfred Health, you can put in your preferences, but I can't say that I can automatically make sure that you all get your first preference.
Okay, what about ward preferences? Is there a choice for ward preferences?
Again, that's something that we have on our application, so you can certainly put preferences in for, as we were just talking about campus, you can also put preferences in for what wards you'd like to go to. One of the things that I will say is that commonly, please look at the services that we've got. So sometimes you'll have people that are saying that they want paediatrics and Alfred Health doesn't have paediatrics. The other thing that I'll just talk to you is that 99% of the applicants will commonly put in ED or ICU. And so we do not have graduates in ICU consistently. Well, we've only got them this year because of COVID, but previous to this, we have not got graduates there because of the complexity of the patient population. We do have second rotations into ED, but there's only a finite number of places. So there's only 12 positions per year and another 4 down at Sandy. So what I always say to people is that ICU and ED, I'm a critical care nurse, my background, is that it's always going to be there. And the key thing is to make sure you've got the basic skills and knowledge throughout your year and a bit more experience. I know all of you are jumping at the bit to get in there, but it's actually something that the transition into those areas is actually a little bit easier if you've got more experience under your belt.
And lastly, my final question is, what are the employment opportunities after the graduate year?
So upon completion of the year, we actually then see how many positions are available in the organisation, and we actually ask grads if they want to remain here. I guess the key thing is, just so you know, we do want to retain all the graduates. So as I was saying earlier, we retain about 95%. You're investing in us, we're investing in you. It depends on where there's ward availability at the end. So obviously with all the COVID thing measures this year. We've actually got a lot of grads redeployed, but at the end of the day, those finishing in July, which is coming up, we want to retain as many of them that want to actually stay here. It may be that if the wards don't have EFT at the moment, then they will actually go on to pool until wards actually create or have positions that open up. So all I'm trying to let you know is that we want to retain as many as we can upon completion of the graduate program. So the other thing, so I guess that's the last question that Caroline's going to pose to me. We know that you've got put questions up online. The goal is over the next couple of days that we'll actually put up a video that's been recording whilst we've been holding this event, and also the questions that have come up. So I guess I'm just going to tie this together now. We really appreciate all of you that have joined us tonight, and I wish you well for your future, whether it's Alfred Health or somewhere else. I'm hoping it's Alfred Health because there's a wonderful program here and there's lots of fantastic experience for you. So whatever you choose to do, I wish you well, and I hope to see you either next year or potentially down the track if you decide to undertake a graduate program elsewhere, but then come over to Alfred at a later point in time. Okay, so all the best and look forward to hearing from you. I'll just reinforce again, you may send emails to Shana and myself, or actually call us. The details are up there and they're on the website that you're currently on at the moment. So thank you again and all the best. I'm just about to end this.